Conference and exhibition will take place on the 13th of September at the All Nations Centre in Cardiff, the first event since 2020, and we look forward to welcoming delegates, exhibitors, sponsors in person in September. Please put the date in your diaries and keep up to date with speakers as they're announced on our website. For those of you who haven't worked with us before, the Welsh NHS Confederation is the national membership body representing all organisations making up the NHS in Wales. This webinar, the first of our hashtag Wellbeing for Wales Series 22, is an opportunity for NHS leaders and colleagues from health and care organisations across Wales and beyond, looking at the list of people who've registered, to hear from Judith Paget CBE, Director General of Health and Social Services and Chief Executive NHS Wales, on her vision for health and social care in the Sixth Senedd term. Judith began her tenure in the midst of a global pandemic, as if being Chief Executive of NHS Wales and Director General for Health and Social Care Services wasn't challenging enough. Judith very kindly agreed to talk to us about her vision for the NHS and to give us an overview of how she aims to implement a Healthier Wales, the long-term plan for health and social care in Wales. I'm sure Judith will draw on her enormous first-hand experience, having worked in the NHS for over 30 years. During this time, Judith has built strong and extensive relationships with colleagues and stakeholders across the breadth of health and social care. Most recently, Judith has worked as Chief Executive of an Iron Bevan University Health Board. And before I hand over to Judith, I've just got a few housekeeping matters to deal with. To notify everyone that this meeting will be recorded to date and be made available shortly after the event. I'd like to ask people to keep microphones off, on mute, and cameras off during the duration of the event, because it can be quite embarrassing if cameras are left on, as one of my colleagues at the NHS Confederation found out recently when they were drying their hair whilst at the meeting. Following Judith's presentation, there will be an opportunity for questions, which must be submitted via the chat function, and I'll put the questions to Judith verbally. And we'll try to get as many questions as possible in, and questions we don't have the opportunity to answer today, we'll follow up by email. Just a technical note that we are in a pre-election period now for local government, and Judith obviously being a civil servant, it does place some limitations on questions relating to local government in particular that Judith may be able to answer. If for any reason there's an IT glitch today, our reserve chairman is my colleague Jane Green, and I'll hand over to Jane. And if you are planning to tweet, the Welsh NHS Confederation will be live tweeting this event. It's hashtag Wellbeing for Wales. And I'll hand over to Judith with no further ado. Over to you, Judith.
Diolch, Darren, and Prynhawn, everybody. Really good to be here, and thanks for that warm introduction, Darren, really appreciated. I am going to use speaker's license just to talk a little bit about my reflections on the pandemic, as well as where I think we need to get to in terms of moving forward post in this sort of COVID stable situation, but also the challenges that we've got ahead of us, but also the huge opportunities as well. So with that, I'll ask for the first slide to come up, please. The second slide, thank you. Thanks. So I'm going to start, as you might expect, with a Healthier Wales. And I know that you'll all agree that when this was launched in September, the summer of 2018, it actually was, we had no way of knowing that our plan was going to be so tested in terms of a global pandemic. And that vision, which was for an integrated system with seamless services, and that focused on prevention and community-based care and going to hospital whenever needed. Our COVID response over the last 2 years has made significant progress towards that aim, mainly through necessity, as we know, to keep everybody safe. But I think we all know, those of us who work across the health and care system in Wales, that we now need to move forward in a positive way to try and build on the changes that we secured and the things that we learned during the pandemic, to make sure that we reflect those in our system recovery or systems reset. A whole host of words are used for that. There was huge innovation across health and social care, and I'll come back to that in a moment, but we really do need to move forward. And I hear quite a lot of people talk about when we get back to how it was before. And I think those of us in leadership roles and leading organisations across Wales will know actually that our role is now to move forward, to reflect on what we've learned and the changes that we've made, but to move forward. So next slide, please. So although I'm going to talk about priorities and a vision, I think we do all have a collective understanding of the challenges ahead. The papers that were published by the Welsh NHS Confederation's Health and Wellbeing Alliance on inequalities and the government priorities for the current government highlighted a number of the issues that I'm going to pick up today. And I think they're also reflected in the Minister's expectations, particularly for the NHS in Wales, that were published in the planning framework in November. Next slide, please. And also just to remind us, because during the course of 2021, we did actually refresh the Healthier Wales transformation programme. I just thought it important just to reflect on the fact that even at that point, we were reflecting across the health and care system in Wales and what had happened during the early year of the pandemic, to think about the refresh that needed to happen to that transformation programme, taking into account what we'd learned from the pandemic experience. And the things that were added to the Healthier Wales transformation programme at that refresh last year were a focus on decarbonisation, a focus on inequity, a huge focus and refocus really on prevention, because it was most definitely stated and a key element of the initial Healthier Wales programme. Children and young people, and making sure that we were transforming our system for seamless care provision, but also thinking about what we could do for effective interventions for children and young people. Mental health in terms of the impact COVID had on our communities. Again, making sure we captured that innovative practice and new ways of working. And a real focus on community-based care, whole system pathways, focusing on prevention, detection, treatment, and ongoing care. So that was just a reminder really that a Healthier Wales was refreshed. We've added more to it based on our pandemic learning, and they are now part of our programme as we move forward in terms of activity and implementation around those areas. Next slide, please. So our current operating context, and you might have things to add to this slide, but the things that I was reflecting on when I was thinking about where we are in our current situation, some of the headlines for me were, firstly, we really need to continue focusing on the well-being of our workforce as they recover from their experiences during the pandemic, but also prepare for the challenges ahead. I think we have to ensure that our colleagues feel supported, that they feel valued for the work that they do, and that we create environments that they feel are safe and rewarding. We know the workforce challenges that we have. I think our collective response around those workforce challenges will have a number of dimensions to it. So it will definitely need to focus on supporting the staff that we have, so retaining the staff that we have. We really need to make sure that we've got clear training and development offers for our staff. We know that we will need to recruit additional staff, And clearly we will need new workforce models as we move forward to reshape our care and healthcare offer. We do know, of course, how phenomenal our staff have been during the pandemic to date. And just to continue to take the opportunity to just say thank you to everybody, including everybody who's joined us this afternoon, for everything that they've done during what have been difficult times, and actually what will probably continue to be challenging times in the near future. I know I've mentioned the pandemic a couple of times as if it's over, and of course we know it isn't over, but we are in a different phase. The First Minister has recently spoken about our move from pandemic to endemic. We talk about moving from reacting and responding to COVID to living with COVID, and clearly the transition plan that Welsh Government have published talks about COVID stable and COVID urgent. And we are still in a COVID stable situation. I know COVID hasn't gone away. You know COVID hasn't gone away. Case numbers have been increasing in recent weeks. I think they're just starting to settle and stabilise a little bit. And we know COVID-related bed occupancy in our hospitals and demand for care across the system has been high again recently. But of course, we do know a lot more about the disease now. A vast majority of our eligible population have been vaccinated due to the fantastic success of the vaccination programme. And I think there's a view now, and I think many people on the call today will, I hope, will agree, that we need to move from that reactive responsive mode that we've done very well and we've needed to do very well into a mode now that takes us back into some longer term planning about how we can make our health and care system more sustainable for the future. Moving on, I think one of the other things that I consider to be uppermost in our operating context relates to reset and recovery. I think there are undoubtedly difficult times ahead with the unprecedented numbers of people who are on our waiting lists, causing real concern, particularly those who have waited a considerable amount of time. We know that there are ongoing complications and issues associated with long COVID that we will need to continue to address. And now we've also got uncertainty caused by economic pressure and global conflict. We're entering a cost of living crisis. And we know that rising energy and food prices, rising inflation, and other things will impact on living standards for our communities and also for our staff as well. So we need to be mindful of that. But despite these pressures, the NHS continues to step up, social care and care continues to step up. And I think we're just seeing that now through the response to the Ukraine situation and the support being offered by Wales as a country to support people who need our support from Ukraine as they flee from the situation there. There are a number of national programmes that will comprise our sort of reset arrangements in Wales. Clearly, later this month, we will be publishing a plan to transform planned care and reduce NHS waiting lists. Clearly, the innovation that we've seen in the way in which planned care has been delivered during the pandemic will need to be retained. We need to think about working together across organisational boundaries to build capacity. We need to think about how we support our staff and workforce in their endeavours to meet the requirements of the plan. And we also need to think very carefully, which I know many NHS organisations in Wales are doing, about how we maintain our relationship with those patients who are on the waiting list and with their families as we work through the backlog of people who now need our care. So planned care, definitely one of the key programmes. Clearly the 6 goals for urgent and emergency care have also been launched. I think we would all recognise the need to refocus our efforts on ensuring that we're delivering good outcomes for our patients who engage in our urgent and emergency care system. There are lots of things that we can do to improve the current environment and urgent and emergency care offer, and we need to think about how we relieve the pressure on departments. And I'm often struck by, we talk about the pressures in our urgent and emergency care system, and I think we all know how they manifest themselves, but that pressure also means relentless workload for staff working across our system as they try to ensure that they do their absolute best for patients in what has been a very busy and demanding time for our urgent and emergency care services. Mental health and well-being will continue to be a focus for the national programmes, improving access for children, young people, and of course for adults and older people will be a key, continue to be a key emphasis, as will the strategic programme for primary care, which has a really important role in building the primary and community care capacity and infrastructure we need to support integrated health and care services at a very local level in response to local needs assessment. We know that health inequalities have been brought to the forefront of the pandemic. Some of the areas that we are definitely focused on collectively in Wales are areas such as Healthy Weight, Healthy Wales. Clearly there's more, an additional resource recently gone into time to change in Wales as well. And last month we saw the publication of the Stronger, Fairer, Greener Wales, a plan for employability and skills which support people with long-term health condition to get back into work. So that's just a few highlights from that, but we know that tackling health inequalities will be a key focus for us, and I will come back to that in a few moments. In terms of financial constraints, we have benefited from additional funding throughout the pandemic and including this year. But I know generally people are very worried about the exceptional cost pressures that are in the system. And I've mentioned some of the areas that will cause some of that already. We will need to continue continue ensuring that the funding we do have is used to maximum best benefit, and we do get the return on investments that we're making across the health and care system. We do need to think about further Once for Wales approaches where that's appropriate, and we need to make sure that we work together to find the opportunities for better use of resources. At the NHS Wales Leadership Board last month in March, we did agree to establish a utilisation of resources group just to provide oversight of the evidence base that we can all draw on to secure financial opportunities and the effectiveness of the resource allocation. In relation to finance as well, not just revenue, I know there are significant concerns about capital availability. So we do have £1.1 billion of capital available to us for health and social services over the next 3 years. But I know that still continues to be a real challenge, with concerns generally being raised about our ability to achieve everything we want to achieve within that capital envelope, and we will continue to look for opportunities for additional capital as they arise. So just moving forward, and thank you for the next slide. In terms of learning from our experience, you will have your own list of your own reflections from things that we've done differently during the pandemic, things that we might want to hold on to and take forward as we now go into this reset recovery few years. A couple of things that I've reflected on. So I think the use of science, data and evidence has been very strong and visibly so during the pandemic. I know at many opportunities our populations will have heard that we are following the science and following the evidence, and I think there is something for us in our system to make sure that we don't lose that. We continue to make sure that we're finding and using evidence to support changes that we might want to make in the way in which we work. I think we've most definitely taken an integrated approach to population health and wellness. The Keep Wales Safe strapline has been used and is well recognised by our populations and our communities in Wales, and is something to think about the way in which we've all worked with a focus on health and wellness. I think we've had a much more of a consistent national approach and direction on some things for local implementation, and certainly for things around like TTP and vaccination, and there probably are others. Those are the two that I often use as examples. The Welsh Government team have been able to say what needs to happen and why it needs to happen, but the how has been very much guided by the service, with the by when subject to negotiation. So I think there is something about the way in which that has worked really positively that we might need to think about how we retain. We've definitely had rapid adoption of new ways of working. We've had rapid decision cycles from development to implementation on changes, which we need to think about. We've used behavioural insights and tested public opinion and sought the public opinion view on messaging and their acceptance of some of the things that we've asked them to do. We focused on health and well-being, not just of our workforce, but most definitely of our workforce across our communities. There's been significant public messaging, advice and guidance. We've had much stronger partnerships, not just across the public sector, which have been phenomenal, but with academia, with industry, promoting innovation, getting innovation adopted fairly quickly, with huge benefits for our communities, but also economy in Wales. And there's just been a whole system approach to working together. And I think some of those we need to retain as we go forward, because it will be so easy to try and slip back into doing things the way we used to do them. And I think we've got an opportunity here to learn from some of those things and move forward differently. So next slide, please. So moving forward then, a real issue around making sure that we can give huge focus around population health and prevention. We know that during the pandemic, people have taken greater responsibility for their own health and those of others. We need to build on those positive behaviours and a key role for public health in prevention, which we really do need to maximise, and lots of examples around communities of practice for prevention and community coordination. We're going to be launching a national framework for social prescribing. These are really important building blocks that we will need to continue to put in place to make sure we focus on health and prevention. And multi-level change is required. We need change across the whole system. We need to be focused on some of those areas where we can all work together to deliver that change. At a meeting earlier this week around the Healthy Weight, Healthy Wales strategy. So multi-dimensional approach to that, but huge engagement across the system in Wales in terms of it recognising that everybody will have its role to play in delivering some of the ambition around that strategy. Improving quality, safety and outcomes across the system is fundamental to what we do. It's fundamental to the NHS, but social care outcomes fundamental too. The Minister has issued some set of measures or outcome measures alongside the NHS planning framework, sort of first 8 of the measures, but there will be further measures to follow. I think we need to go back to ensuring that we're now focusing on the national clinical framework, making sure that some of the tenets of that framework are now brought to the forward as we redesign the way in which care is delivered going forward, on the basis of the prudent principles that we know so well in Wales. We need to clearly recognise the contribution clinical networks can play, how the quality statements need to be moved from a statement to implementation, the role pathway development will make in our system, and making sure that we embed population health and regional working across our system to make sure that strengthens our approach to delivering quality and safety. The National Clinical Framework did have a focus on clinical pathways, reducing variation, and ensuring an equal service for patients no matter where they live. The framework did describe national, local system and professional level roles. It also assumed a key role for the NHS executive, which has been something that's been in the thinking for a number of years. And I know progress on the NHS exec has been delayed by the pandemic, but I do hope that we'll be in a position very shortly to start some visible stakeholder engagement on taking that forward, because it still is a very key part of our thinking about how the system will progress in Wales. Clearly, digital transformation and use of data to improve service delivery is incredibly important. We know the pandemic has drastically altered the way in which we access services, huge benefits. This has definitely transformed our services, but also transformed the way in which our patients and service users engage with us as well. We need to make sure that we are continuing on that agenda, but also making sure that, going back to my earlier slide, that we're also using good quality and timely data to help us in service delivery, service redesign, and decision making. A whole system approach to integrated social health and social care was a key tenet of a healthier Wales. It still remains an important part of the strategic agenda for Wales. I know integration is quite complex. A lot has been written about how to do it and how to do it well. We still have some issues to overcome, but the work of the regional partnership boards and the work that health and social care, housing, the third sector and everybody else are actually doing at a local level to work on those integrated models is really important. And we need to make sure that as we move forward, that continues to be uppermost in our thinking. In terms of that also, I'll probably mention the accelerated cluster development work. Those of you will know that when I was the chief exec in Iron Bevan, I was also the lead chief exec for primary care for Wales, and really pleased to see the work that's now being published around the accelerated cluster development programme, informed by a massive conversation about what people wanted from clusters, and great to see that coming out now to organisations for progress. Social care reform as well, still the ambition to create a national care service, free at the point of need, recently further endorsed through the cooperation agreement between Welsh Government and Plaid. The expert group has now been established on that, and we should get some early indication from them over the course of the next month or so around direction of travel. But there is a broad aim that some of the changes associated with that will need to be implemented during 2023. Lots of work still going on to design not only how that national care service will work, but also the national framework for care and support, the development of the National Office for Social Care. Still work to do about how that will align with the NHS executive, but that's on my list of things to pick up. And again, the parity that we need to try and achieve around pay, training and esteem for social care staff alongside the NHS, really important. So moving on. So to achieve this, we will need to continue to work together. I think Wales is a country that has huge opportunity and potential to do things differently, to respond really well to the challenges that the pandemic have now left us with, not just us as organisations, but more importantly, our communities. We need to continue working with our patients and our carers and communities. I strongly believe that services must be designed with the people that they're intended to support in mind, and whatever we do about the way in which our services are to be delivered going forward, we need to be engaging with our patients and their families and our communities. We've got the Citizen Voice Body on the horizon for next year, work on that in development, but the Citizens Voice Body will also have a really important role in making sure that we hear the voices of people who are using our health and social care services across Wales, and that we can respond to that feedback. I also, and I've mentioned it a couple of times, to make sure that we continue to be working in partnership across our system in Wales. I've talked about academia, I've talked about industry, making sure that we're moving forward with the innovations, using the opportunities that life sciences and innovation brings us to do things differently, adoption and design of new technologies, but also in terms of delivery, a real strong urge for NHS organisations to work together across boundaries to actually ensure that we can move our services on quickly and give patients the opportunity to be treated where we can deliver capacity in a different way. The partnership with other public services, RPBs, PSBs, really important, and wanted to leave this slide, although there is just one, where we started with our workforce, because without our workforce in terms of engaging with them around that innovation, around changing the way in which we work, around getting their ideas about how we change service delivery, about ensuring that they feel valued, motivated and engaged in what we're doing, but also that they've got the capacity, skills and confidence to meet the needs of our patients, our service users, really important as well. So I just wanted to end that where I started. In terms of vision, the Confederation said, oh, you know, can you think about what your vision is for the future? So I thought I would end with a slide that for me tries to bring together some of the parts that we've discussed, or that I've discussed this afternoon. So we can move on to the next slide, please. I think in terms of my vision, and again, you could probably add a couple of bullet points to it. I think we should have a Wales in which people feel able to look after their own health and the well-being of their families. When they need help, it's available for them in their own home, in the local community, or in the most appropriate setting to their needs. That we work together in a modern and sustainable system to consistently deliver safe care and the best quality outcomes utilising best practice. That compassionate care is delivered by our talented teams that we've got in abundance across our health and care system, who've access to the most up-to-date technology to support care delivery. That our teams feel empowered to make a difference, listened to and valued, and able to make their best contribution without any fear of discrimination or disadvantage. And that we care and learn and improve together to build a more resilient communities, reducing inequity and inequalities, and position Wales as a global influencer in population health and well-being. And of course, ultimately, we want to meet our wellbeing objectives, and we want Wales to be a great place to live. And of course, for us, a great place to work as well. Thanks very much, Darren. Diolch.
Diolch yn fawr, Judith. Thank you very much indeed. A huge amount of ground covered there, and it's brilliant for all of us listening to hear firsthand your reflections of how things have gone through COVID, your experience working in the NHS for more than a few years, and a lot of your vision of the future as well. And I think our reflections coming into this and the feedback we've had in questions are all related to workforce, and we'd like to acknowledge that as well. Without the workforce, the NHS and care services in Wales would be nothing, but also those people working unseen in communities as well.
Yeah,
we've had a few questions in advance, which I'll ask verbally, but please, colleagues listening in, do post questions in the chat bar on the sideline, and then I can feed in to Judith. Judith, you did talk quite a lot about the interactions between health and social care, the white paper, the cooperation agreement between Labour and Plaid Cymru, which are looking at some of these key areas. I'm just really keen to hear a bit about your vision for the interaction in the future between the National Care Service and the NHS, and how that can deliver for the people of Wales.
Thanks, Darren, and thanks for the question, whoever submitted that. Clearly, the National Care Service has an ambition for free care, free at the point of need, with social care absolutely remain in the responsibility of local government. But we know that there are opportunities to bring our systems even closer together, which is really important. I think as that work develops, I think across those of us who will be involved in the planning for that within Welsh Government, we will be thinking about what does that mean in terms of bridging that gap and what opportunities there are. I mentioned the National Framework for Care and Support, and the National Office that's planned to be established. I do think there is the opportunity to have that aligned with the NHS executive in some way. So we're bringing health and care closer together at a national level in terms of delivery. Clearly it's in the same group within Welsh Government, as well as at a local level, because I know at the local level teams are working really hard to deliver integrated care. So there are opportunities coming forward, and I think as that thinking develops, as we get the feedback from the terms of reference as we get the feedback from the expert group, I think we'll just need to think about what opportunities that might bring to us.
Thanks very much, Judith. And I think we've all seen a much closer working between the NHS, local authority, the care sector and communities through COVID. And really interesting to hear your reflections on how we can drive that forward even further, because people we all talk to, they're not concerned whether the care is provided by local authorities or the NHS. It's about providing, as you said, the care they need in the place they need it at the time they need it.
Yeah, and I think just to add, I think the regional partnership boards have been working really hard in this space. I think the regional integration funds and the predecessor resources have allowed people to think differently about how they redesign their services in a different way. So I think, I think it's just building on that. Haven't got any categoric answers, but I think we're in a direction of travel. And I think from a policy point of view, all of that is moving in a positive way for bringing health and care even closer together, both nationally, but also locally.
No, thanks very much for that. Another question, and apologies, I don't get to see who's asked the questions from the feed I've got. And it's very much a related question, really, around integration. We've talked about integration between health and social care, but also integration across health in terms of primary care and secondary care. And, what are your aspirations, really, and how do we get there? You've talked a lot about that sort of seamless health and care provision. Can you tell us more about how you think what we need to do to get there?
Yeah, I mean, I think integration is one of those words that's used a lot and is really difficult to deliver. when I was clearing out my office in AB to move into the role in Welsh Government, I was sorting out my bookshelf, and I can't tell you how many publications I had on delivering integrated health and care, and very much of them, they had very similar themes, and there's some really brilliant examples around Wales and around the UK of people doing absolutely great things, but they mostly have some core components to them. So they have integrated assessments, integrated standards, so clear, consistent standards. They have an integrated workforce with consistent training, and they have an integrated policies and procedures and philosophy around what they do, when they do it, and how they report, and clearly how they use money. Lots of them having single budgets to do that. So I think there are some great examples, and when you read evaluations, they often nudge us in the same direction. So I think it's about that. The other thing as well, of course, is they have integrated digital systems that allow them to keep information about people, service users, I'll use that term, service users in one place, that people can see the information, that everybody's using consistent information, and good information sharing arrangements that go alongside that as well.
No, thanks very much, Judith. That's a really helpful overview. In terms of working with, we touched really on the value of the workforce, and there's a question come in around that, working with the third sector, and it's something I've definitely seen firsthand in my community and during the day job. Amazing examples of the third sector really stepping in when help and support was needed. And I think the question is really around whether, when you're talking about system, are you also including the third sector as well, and how do you see what they might be able to do in the future, giving even more of a contribution?
I absolutely do include the third sector in that. I include them in all my descriptions about health and care, because I think they play, have always played and continue to play a really important part in terms of the way in which we organise and deliver our care. So they are for me just part of the description I use. I think pre-pandemic, huge opportunities, and the third sector doing great support. I think through the pandemic, that has just been so much more visible, and those opportunities have been huge. I think across the system, across the health and care system, there are opportunities for the third sector to be involved, both around place-based care, so what clusters are doing at primary care level, at community level, definitely within hospitals, definitely within care delivery. Yeah, I just see a real continuing important role for the third sector. Personally, really keen to support that development and moving on from annual budgets to 3-year budgets, so people can plan and think about how they're going to organise their services to align to the health and care systems and priorities. Really important.
No, thanks very much, Judith. And I know from talking to colleagues in the third sector, there's quite a lot of evaluation work going on at how they can maintain the infrastructure that developed really quickly through COVID. So, ready to go and build upon in the future. And I think the point you made about moving from annual to 3-year budgets is definitely something, as you know, the colleagues in the NHS are keen to move towards as well.
Yeah, absolutely.
Another question from the floor around workforce. You mentioned at the start the importance of workforce well-being was something we all acknowledge. And the comment is, as part of this, we need to listen to frontline staff. Judith, can you give us some examples and a bit of detail really about how you think this should happen, and how you expect those sort of experiences to be fed back up into management and ultimately to you and colleagues in Welsh Government, and if you've got some good examples of where this is working well?
Yeah, thanks, Darren. So, I often rely on my most recent experience of working in the NHS in terms of how leadership teams at whatever level engage with frontline services. And I was actually asked a similar question this week by one of our trade union colleagues around how do we ensure that during times of very busy times and pressured times, that actually teams across the NHS are actually reaching into services and departments, that the teams are feeling supported, and that is reflected up through escalation. And I was able to say absolutely it was. I think there are a myriad, aren't there, of ways in which we reach out to staff. There's all issues around surveys and well-being surveys and those sorts of things, which I absolutely have their place. I do think for most of us, going out and talking to staff is the most beneficial way. And I know across the NHS and in social care, going out and talking to the front line about their experiences, what would help them, how can we change what we do, what are the impacts, what are they feeling at the moment, how can we support their well-being. Really important. I've been absolutely privileged over the course of the last 3 months really to be visiting some of the A&E departments across Wales and talking to frontline staff about their experiences, what needs to change, and also feeding back. So how's that IPC guidance working? What can we do to support people? What more can we do? What more well-being support do we need to provide? So I think it's really important that I keep in touch with what it's like on the front line, but throughout the NHS and within social care, we do the same.
No, thanks so much for that, Judith. And I know that many of the meetings I'm at with colleagues from health boards and from other NHS organisations, Health Education Improvement Wales leading on the sort of development of compassionate leadership and supporting organisations, and from colleagues in local government as well, being privy to the same conversations. The well-being of the workforce is key, and the solution to many of the problems comes from that engagement with them as well.
I think so, and I think, I'm really supportive of the work Health Education Improvement Wales are doing on this, because I think from a leadership perspective, our leadership impact is from our behaviours, and our behaviours are mostly guided by our values. So I think the work that HEIW are doing, but I know lots of other people are engaging it as well, really important to setting the tone for how we want to work in Wales, because this is about tone, and our job in leadership roles is to set tone for our organisations and our teams.
Yeah, no, thanks very much for that. Mike Gorgonowski says he's asking for a friend on this one.
Yeah.
So you can probably guess at this question.
It's going to be something about digital.
It certainly is. Great to see technology mentioned alongside the clinical framework and social care. How do you think technology-enabled care can help the agenda of crossing boundaries between health and care?
Well, I'm hoping that Mike Gorgonowski can give us the answer to that, as he's been leading some of the work in Wales around that. But certainly the reshaping or the remodelling about the way in which care is delivered, huge reliance going to be on technology-enabled care. I know some of the work that Mike's been leading with the team that's hosted in AB, so it's not AB particularly, but it's hosted in AB around supporting care homes and other parts of the care system. Has been really great, and I just think more of that, really, absolutely more of that. Technology-enabled care, using digital to redesign the way care is delivered, helping us change our pathways, getting best value out of our system, but also providing the right care at the right time. Really important.
Yeah, and I think it is one of those things that the digital bit is unseen. There's huge amounts going on behind the scenes that can make a huge difference to the quality and provision of care on the front line. But often a lot of the work that colleagues in digital are doing is that sort of unseen bit.
I think it is unseen, but it's so fundamental to what we do.
Yeah.
And if I just think through the pandemic around video conference calling, our use of Teams in order to keep connected, the Welsh immunisation system that we set up in order to capture all the information that we have used so well to drive our vaccination programme. So many examples of things that we have used that have been set up quickly, that have been reliable, that we've used really well, and that approach needs to continue.
Yeah, definitely, here we are.
I hope Mike liked that answer.
and here we are today, people from all over the country, engaging in this conversation, yeah. Which a lot of us
wouldn't be able to do, would we? Yeah.
Yeah. A question on another issue you touched upon in your presentation around sustainability. Mm-hmm. How do you see sustainability agenda weaving across the portfolio and system of work? So big ambition for Welsh Government on cutting carbon emissions, sustainability of environmental sustainability.
Yeah, so I think there's never the wrong time really is to focus on decarbonisation and what we're going to do to focus on renewables, and this is as good a time as ever. I think the opportunity for the NHS particularly to make a real contribution to the decarbonisation agenda. We have done already, but we must continue to. We run lots of buildings. We have lots of staff who drive back and forth to work. We have lots of patient journeys. We have lots of things we move in vans and lorries around the system. I think there is a huge opportunity for us to do things differently. I mean, we've been very lucky with some of the investment in our new buildings that have allowed us to take advantage of all the opportunities to limit carbon production, but I think there's so much further to go, and we will be doing more on this, and there will be more I'll be saying on this next month as well.
No, thanks very much, Judith. And this change to ways of working, if we look, as you say, the amount of travel that's reduced by some hugely ambitious targets out there for colleagues to meet. And I think it'd be remiss of me not to sort of mention some of the challenges which you alluded to earlier around capital investment that colleagues in NHS leaders are sort of telling us about, that they'd like to be doing more, which I'm sure you've heard before.
Yeah, they'd like to be doing more, and we'd like to be doing more as well. I think you'll have to leave that one with us. We are continuing to look at what other opportunities there may be to secure more capital. I do absolutely recognise the collective ambition we have in relation to decarbonisation and the opportunities to do things differently. So yeah, leave that with me. Yeah.
Thank you very much for that on the record commitment, Judith.
I just said leave it with me.
Another great question, and just to remind people, we've got just over 5 minutes left for this session. So if you are intending on submitting a question, now is the time to pop one in the sidebar. System working is the way forward to deliver care effectively, which is a point we've raised already. Do you envisage that there will be a national performance management framework that reflects the system, including integrated combined measures for both health and social care?
So I can't give a categoric yes or no, but I can give my view. I think that there is a possibility that we could get to that place. I do think as we develop the national care service and national office, if it works alongside the NHS exec, and we have some consistency of approach across Wales, then I think that would be possible. I think we're still away from that, to be quite honest, but I understand the desire of the system for that to happen, because I think we do measure different things in different way, and the health and care system is so closely intertwined, I suppose, in many aspects, although clearly social care is important in its own right. Social care really important to supporting people to live independent lives, irrespective of the NHS, but clearly that support closely tied in. So I would like to think it would be good to get to that place. I think we're a little way from that development at the moment.
Thanks very much, Judith. And again, it's something that I think the wider public have become aware of through the COVID pandemic, is the hugely important role that colleagues working in social care play, supporting people to stay well, to live their lives. And recently, I had the opportunity to talk at the carers conference, and just huge pressure that carers are under looking after people in the community.
Yeah,
and we've had
Go on.
Sorry, go on.
No, I was going to say, one of the last things I did before I left Anira and Bevan was to actually do the same, to go to a carers group. They invited me, which was lovely. And I was just completely overwhelmed, really, by hearing their stories of what they'd been doing during the pandemic, and how much support they'd been providing for their loved ones, their relatives. And yeah, it was quite moving, I have to say, in terms of hearing their experiences.
Yeah. Now, we heard a lot, as I'm sure you did at that event, is the impact on carers' health there is from the pressure they're under in looking after family and loved ones, and how they would sort of value more support through that. And there's a question around how we can make sure health service staff have adequate training to identify carers at first point of contact, to enable them to be signposted to support and information resources that might help them. So just keen to hear views on that one.
Yeah, I mean, it's been quite difficult during the pandemic, hasn't it? Particularly for NHS staff who, you know, for particularly in relation to hospital care. So not so much in terms of community care, but in relation to hospital care, where we haven't been able to have the benefit of carers and family members alongside patients to have those dialogues, and it's always been really difficult to do that in quite a false environment where everything's being done over the telephone and things like that. I mean, certainly in terms of the assessments that are done for patients, the individual assessments do ask about carer support and carers and those sorts of things. I think as we move forward, clearly looking at what we're doing to support people on discharge as well, we need to think about the questions that we're asking. Clearly, discharge support for carers on discharge, and signposting people to support that they can receive is a really important element to that.
Yeah, thanks very much for that, Judith. Again, that signposting is an issue when you're not meeting people's carers and support workers face to face.
Yeah,
and we've got 2 minutes or 1 minute, as the clock says, left. Just any sort of final reflections from you, Judith, of any points you'd like to make in relation to the questions or from the presentation, and before I sum up?
No, just thank you for inviting me. It's a huge privilege to do this role. I had every expectation it was going to be a challenging role, but also it's a huge opportunity as well. But thanks for inviting me, Darren. I'm really grateful. Thank you.
No, thanks very much, Judith, and I'm sure I'm speaking for everyone. That was a hugely interesting presentation. Great to hear your reflections on some of the key challenges and issues going forward. You know, we're still got a huge amount ahead of us in terms of the pandemic and recovery from the pandemic. I think the questions and your presentation acknowledge that the staff are, you know, key to this. Staff employed by the NHS, staff in the community, but also those unpaid carers and volunteers who are making such a huge difference. I'd also like to thank the team in Confed for the help in pulling this together today, in the team in Wales and technical colleagues as well from Leeds, the best county in Yorkshire. York is Yorkshire, so I'm told, which colleagues in Yorkshire tell me is nearly as big as Wales, but I'm not going to get into a debate about that. Thank you to all attendees today as well for a great level of interest in what Judith had to say. Real ask for people, really. We'll be coming to you shortly with some evaluation and some questionnaires to follow this meeting, with ideas for future events, future speakers that you'd like to hear in the Wellbeing for Wales forum. So thank you all. Thank you to Judith in particular. It's been hugely interesting. Really appreciate the support you give us at the Welsh NHS Confed, and, you know, look forward to seeing you all again. Yep, but thanks very much to Judith and your team as well.
Yeah, thank you.
If it lets me.